Hello, this is Dr. Kevin Christie. I'm going to go over two of the bad postures we see in the golf swing. It happens a lot and it causes many different conditions. Today I'm going to cover the C posture and the S posture. C posture is going to be more for the upper back and the S posture for the lower back. Both cause many issues in the spine and even the shoulders for golfers, so it's one of those things we really want to make sure you're working on. I believe it's really three things that need to be addressed. Sometimes it's just not understanding the golf stance and posture and address, and that's maybe what you need to work on with your golf pro. Two, sometimes it's just not awareness of your body, and it's just postural awareness, like keeping sternum up and not understanding that. And then three, sometimes it's physical limitations or pain conditions that you're suffering from that you need to be addressed by a doctor that really understands the golf swing and understands the body and can really help you with that. So with the S posture in the low back, what you're going to see with the golfer from the side here, you get your golf club, and what happens a lot of times is you'll see they arch that low back. So I'm exaggerating a little bit, but to give you an idea where they've got that deep arch to the low back, and when they go into the backswing and follow through, it really, unfortunately, it causes the low back muscles to become really tight, and it jams the facet joints of the low back, which are just the joints of the posterior aspect of the spine, and it causes a lot of low back conditions. A lot of people are misinformed that that's proper golf posture, and it's not. And so that particular golfer needs to get that pelvis tilted posterior a little bit. So if they're like this, they need to get it more into there. You really want that straight, what we call a neutral spine during the golf swing, okay? So that's the S posture, leads to a lot of low back conditions. The next one is the C posture, and as the name implies, it's that rounded like that. So you'll see a lot of the golfers, especially in the upper back, it can be very rounded, and when they're like that, it's going to cause decreased mobility in the golf swing, put a lot of stress on the shoulders, the mid back, the low back. It just really is a very detrimental aspect to your body when you're doing that. And again, sometimes that's just not understanding the golf posture during the stance phase of the swing. Sometimes it's actually can be a club issue as far as fitting, so that's got to be something to be addressed. And it goes back to also some physical limitations that you may have. And so we see these two a lot in our clinic. We do a lot as far as assessing it, treating it with active release techniques, some of the muscle work that we do, try to find some of your muscular imbalances, weaknesses in certain areas, tightnesses in others, and try to address that. A lot of times with that C posture, there's a lack of thoracic spine or that mid-back mobility, and chiropractic adjustment can really help with that. It's one part of it, but having a comprehensive evaluation, exam, and potentially a treatment plan for you can really help out. I'm Titleist Performance Institute certified through the medical track, so they teach us all these different types of postures and how it relates to certain golf injuries and how to assess it, how to treat it. So if you feel like you're suffering from this, we could definitely help you out with at least a comprehensive exam to figure out what's going on, and then see if treatment protocols would help you out. So have your golf pro check that out, or the mirror, or a friend, or videotape yourself. Look for that S posture in the low back or the C posture in the upper back.